Do you feel pain in your ear? Do you feel tight in your jaw? Does your jaw pop, grind? Do you feel pressure in your inner ear? Do you feel like your eustachian tube is locked down and you can't open it? Like when you're in an airplane and you go like that, you can't get it to open. If you have any of these things, that one is called eustachian tube dysfunction. If you have tightness and pop in the jaw, they call it TMD. If you have ringing in your ears, it's tinnitus. All of these things are highly correlated to upper cervical spine injuries in the past, and many of the times when patients come in suffering with these sorts of things and we ask them about trauma history, they say, no, I've never had any trauma, but it can be simple things like being rear-ended at 5 miles an hour. Blunt, sharp, jolting type traumas can cause the top vertebra to structurally misalign off the floor of the skull, and when it gets locked out of position, the way that's tied into the things I just talked about is the upper neck controls muscle tone through the whole body, muscle tone of the mastication muscles, muscle tone in the eustachian tube wall, which keeps it patent or open. Just like your trapezius muscle can go into spasm, the muscles that line the eustachian tube wall can collapse, and that is due to the muscle being tight due to structural problems in the upper cervical spine interfering with the central nervous system and causing these muscles to be chronically tight. The solution in many of these cases is taking 3D imaging of the upper neck, determining exactly how that segment has locked out of its normal range of motion. And everybody's different, everybody's anatomy is built different, so the 3D imaging allows the upper cervical doctor to find the pattern or direction in which you're out of alignment, and to measure the angles on the joints, because everybody's built anatomically different. And then a unique force to your pattern of misalignment is delivered to get that vertebra back in its normal range of motion, to get the irritation and interference off the central nervous system. And at the end of that, when the nervous system works better, the postural muscle tone starts to come back into balance, the imbalances in the mastication muscles start to return, and many of these problems that I mentioned will either greatly improve or completely go away altogether. Thanks for listening. I hope this video has reached people who are desperate. They've been everywhere, and unfortunately they're on TikTok looking for health solutions because the mainstream system has failed them, and they're tired of swallowing medication. They're tired of going from doctor to doctor to doctor. They don't want their symptoms treated. They want the underlying cause fixed. And that's what we do in upper cervical chiropractic offices.